Firstly, a very warm good evening to all the attendees, speaker, and the host. Welcome to the series of webinar, which is hosted by MedleyMed on sales growth and opportunities of SaaS products in digital healthcare. And I take this opportunity to welcome today's speaker. So here is the speaker, Mr. Ajeesh. Coming to Ajeesh, he is currently a sales head for MedleyMed Solutions Private Limited, and he holds 10 years of varied experience in sales across IT and many other industries. And Mr. Ajeesh is an alumni of Horizon Institute of Science and Technology. Once again, welcome Ajeesh to the panel.
Thanks, sir.
And let me introduce the moderator. He's Mr. Anirudh Kotopalli. Mr. Anirudh is currently an operations manager for Medley Medical Solutions Private Limited, and he holds 15 years of experience in product management, business intelligence, as well as data analytics. Mr. Anirudh will be moderating the sessions for the day. Anirudh, you can take it from here.
Thank you, Sharath. Thanks for the warm welcome. Hi, Ajeesh. How are you?
Hi, Anirudh. Thanks for asking me. I'm doing good. And how about you?
Doing great, Ajeesh. With the kind of vast experience that you have, I have a couple of questions, which would help us get some information or knowledge about how the products or how does this telemedicine company takes forward, goes ahead in the coming years. The first question is, how does the company evaluate its new products and services?
So, evaluation of new products and services for any company. So they need to work on three different factors. One is the market size, one is the growth, and one is the target audience. So these are three factors any company need to be considered. The market size. We need to understand the market size of a particular product or the service which is going to field. So there's, for example, you consider as a telemedicine. Telemedicine acceptance has been very high post COVID. So since this telemedicine is not new to the what you call health tech companies or health people who are there in other companies, Western companies and all these Western sides of countries, this is not new. But comparing to in this current scenario or current situation, telemedicine has become very useful on daily basis to health providers or end users also, because the acceptance has been increased due to this COVID. So we have to especially need to say thanks to COVID that acceptance rate has been raised, at 2x or 3x, especially in healthcare industries. Okay. But for evaluation of new products and service, this is the area of the market size we need to consider. Do any particular product we need to be which can accommodate the new sellers or which can accommodate new end users to take that product. Okay, that is one thing to understand the market size. And there comes about the growth. So whether you need to also understand the products will be grown in the next 1 or 2 years or next 5 years. You need to consider, is there any growth of particular product? Because this growth will only happens when there is acceptance of the end users level, right? So you also, any company, whenever they do evaluation of this product, they also consider the growth of the product for the next 5 years. So this is the second product, and the main important was the target audience. Whom we are targeting your product. So this is the main aspect or main factor for any company for launching or evaluating any product. The target audience, if the target audience, if you choose wisely, then the acceptance or the adoption, or you call what the service you have been taking, that will be helpful for a daily basis. There are some products which helps for a daily basis. There are some products which may helps on every fortnightly or once in a while in 2 months or 3 months. So it depends on the product, the target audience you choose. So the evaluation of products also been taken care of. Let's say, for example, telemedicine. So since we are talking SaaS products, there are many SaaS products in current scenario, across different industries. Let's say, for example, for the sales people, there are CRM tools, which is SaaS based, Lead Square, Salesforce, and all this stuff. If you compare to healthcare industries, which like post-COVID, we have M5, Apollo, 1MG, and telemedicine solutions. So these are the products which came up into these industries, and the target audience are different. Let's say for CRM tools, it's the salespeople. So the salespeople of companies is the target audience, and for the healthcare, telemedicine solutions is target audience is the end users, and that also routed to the hospitals and the doctors. So these are the three major areas where we need to consider whenever we are doing any evaluation of product or service.
So, I mean, now when you speak about growth in the next 5 years, or the coming couple of decades that we are going to see, how do you think, and where do you think the opportunity lies for the SaaS products for healthcare in the next 5 years to 10 years, probably?
Okay. Since I was telling initially the 5 years of the growth of SaaS products, let's take a small example here on the SaaS product, right? So what is the opportunity of SaaS products? And what is the acceptance? What is the growth of SaaS products? So SaaS, let's the recently time, Lead Square, just like just mentioned earlier, Lead Square, we are doing for the sales people. It has been raised a funded of 153 million just in a couple of days back. So you can imagine how the acceptance, how these health SaaS-based products have been growing up dramatically very fast. Okay, since this came into existence very long time, and because the SaaS products will be making your life easy on a daily basis, right? So the manpower, whatever the operational work the sales guy is doing, it can be synchronized by many hours, and it gives more effectiveness to work towards your goals also. So that is one product. And especially if you look into it, healthcare industry. So again, it comes with a lot of healthcare startup companies been came up post COVID. There is a lot of if you see in a month, there'll be hardly a 5-10 new startups been coming into the healthcare industries. Out of which are highly accepted or highly booming is currently is the telemedicine platform, and obviously other diagnostics and online pharmacy. So these three platforms, apart from these three platforms, there are a lot of opportunity for radiology, and also cardiology also coming up in the next down the line. So there'll be a growth. See, assuming the current growth of telemedicine consultation, telehealth, which is almost $100 billion. According to the survey which we have received, by 2022, it is $100 billion, and we are expecting that can be nothing. It's close to $600 million by 2028. So the next 5 or 6 years down the line, so the growth is there. There is a lot of opportunity for any health startup companies to make a lot of revenue. And not only on that perspective, if you look into the acceptance, thanks to again to the COVID, the acceptance raised a lot of for the end users. So, most of the rural people also been going to the internet and taking a lot of use of internet. So they're also using these teleconsultations and all this stuff. But again, there will be a downfall. That's what we feel, because post COVID now the people are most going back to hospitals for the physical visits and all. But going forward, it also become on a daily basis, or it will be very useful to the end user to take the consultation sitting at home. Okay. So why this happened? Because most of the doctors also been changing into different platforms. They are coming back to normal physical to virtual also consultation to give the service online also. They're spending more time to give the practice online also. Why? Because the next generation, the current generation who are which most of the people are underdeveloped or uneducated people, the grandparents. Let's take my example, grandparents. They doesn't use of what do you call internet, right? So they're not use of mobile technology and all this stuff. But down the line, once these generations comes up every year, the acceptance rates also go down. So we might see a decline of acceptance next 1 or 2 years, but predominantly it will increase by 2028. The most of the SaaS products or any related to tech, which in terms of healthcare industry, will go virtual and online only. So we see a lot of opportunity for the healthcare startup companies to make some revenues for those companies, irrespective of they come up, because we see there is a lot of new technologies also coming into added into SaaS platforms. You see, AI technologies. Since AI is also not new, but for AI, it is more of very expensive for any startup company, or you want to develop it on put it to live into the market. AI and machine learning, these are new features which are coming into SaaS to make even this life easier to the health startups companies. And that is the area where healthcare startups also looking. If I tell you earlier also, this teleradiology and the other streams which coming up with this AI feature. And this is the next generation, we can say, this coming healthcare startups. Mostly, each and every corner of any hospital, they might acquire this AI technology, AI bots, for that particular thing. And as I mentioned earlier, the adaptation. adoption rate is on telehealth is predominantly high. So dramatically, if you see post-COVID, its adoption rate is very high, pre-COVID and post-COVID, and it will rise also because once the acceptance is came up, then what do you think? Most of the people start using that technology also. That is one thing which I want to say, and obviously, then the next 5 years there is big revenue for healthcare startup companies. So they are implementing with the new features into their SaaS platforms, then there is a lot of scope and opportunity for the SaaS-based products, and that is proven by others. For taking examples of recent fundraise by Lead Squad. These are latest update, which can see there is a lot of growth for SaaS products.
So I mean, as we see the growth and this being extravagant in the coming years, how do you think MedleyMed as a telemedicine platform or a teleconsultation platform would be unique, and what are the unique features that it has when compared to its competitors as such?
So comparing with that, MedleyMed has features. So telemedicine, before I get into it, I'll explain what telemedicine has the basic functionality features. So most of the any startup companies or most of the any company coming with the telemedicine platform, they have the basic features which inbuilt which is required for the telemedicine. One is the appointment scheduling, appointment booking, and doctors consultation, availability of doctors, and the chatbot is all these things. So these are the basics which is required for teleconsultation. And how frequently, how the teleconsultation or happening. So we need to understand the platform wherever we are choosing. So is it a data security? How good is the data security of this platform? How the telemedicine flow is being it is to be considered. I mean, it is user friendly or not. That is one thing. Whether it is HIPAA compliant or not. If it is in India, obviously there is no regulations. But apart from India, they need to follow the regulations of HIPAA and other company policies and all this stuff of countries. And second thing is that features. So features, I can say, since MedleyMed do also customizers of product, apart from which we give most of the features. Apart from that, we also do customization. So that is one unique feature at affordable prices or reasonable prices. We do that development for the clients. And our application is very user friendly. It is more or less self-explained. Anybody can once we go through one single process, we can understand easily. And we have some pipeline that we coming with the new features. So just like we just mentioned before, AI feature and other EMR, all this stuff. We are building that in the coming months or coming nearby. We also launched that into the feature. And comparatively, there is a lot of CC. You can see a lot of telemedicine companies have been come up, but most of people are not surviving in this field because of they are not focusing on the market and they are not focusing on the product also. So they are sticking to their product. They are not enhancing the product. So until unless you enhance your products in the market, understanding the requirements of the end users and the target audience, so we cannot survive for more longer. So obviously companies will run for the revenue. So revenue obviously generates when your product is it is useful to the end user or your target audiences. That is one thing which I was.
So, I mean, how do you think, with the current scenario going on, how do you think the current health providers would benefit or get benefited with the change in the process from an offline consultation or an in-person consultation with a doctor, moving on to an online consultation? How do you think this would affect, or what is the kind of learning experience that you had seen with the experience that you have worked with different companies as such?
So I'll take in this case I'll take my personal experience that. So post COVID, when the COVID hits, most of people are sitting at home. So thanks to COVID, again I have a lot of time to spend with my family. But again, hospitality. You wherever you have somebody who body may not listen to you whenever it gets sick, right? So we need to consult a doctor. So there was the area of this teleconsultation has been raised up. There is the area where the people have been accepted. And most of if I take my scenario, I've consulted online for my parents, and that gives me more confident. And obviously, it's very easy to consult any doctor across any there is no barrier, first of all. So I can consult any doctor. So my parents are from southern states, so they don't understand Telugu. So what I've done, so I cannot travel anywhere in the COVID time. So I consult a doctor which is sitting in Kerala, and they can speak Malayalam language. So I can choose a doctor who can language preference. There is no barrier to consult any doctor. So that helped me one thing. So to easy way to access for the doctors. That is one thing, and there is no traveling cost, right? There is no waiting period for consultations and all this stuff. And and obviously I can also save money due to this by traveling charges, waiting charges, hospital booking, and all this stuff. So I personally I feel there is very benefit by doing the online consultation. Unless it's very serious. The primary care, if I say simple words in a layman terms, I can say the primary care can be reduced by doing a virtual consultation. And for the doctors or for the hospitals, it will also helps to expand their services into different states or different countries also. There is no barrier for them. Okay, so in clinic visit and offline and online, there is a lot of difference here. Some traditional doctors, personally based on my experience, some traditional doctors is still able to not accepting the online consultation. Okay, so due to this, what happening for them? They're losing patience for them, first of all, because a second opinion is always not in control of doctors, right? So I personally, when I visited a doctor, I may or may not go to the same doctor. I can go for the second doctor. I can choose for the second opinion doctor. So that second opinion can also be taken virtually instead of going to online visit. So this is also need to understand there is importance of online consultation also. So you can choose your own doctors, or you can choose your according to your time schedules and all this stuff, and you can choose your particular language preferred doctors or something like that. And mostly I can say it will majorly help of elderly. If you have any uh, parents who are elderly, for them obviously sitting, it is very helpful for online consultation. I personally see and personally experience this kind of thing. And if I talk about the business perspective or the sales perspective, we see a lot of up and downs in this virtual online consultation telemedicine product which we sell to the different clients. So what we see is that one thing is that the costing and the data security. The major part is the data security. Okay, data security. How this data security happen? Most of people, these doctors are not tech savvy. They are slowly adapting the technology. Most of people. Okay, and the companies like hospitals or the healthcare aggregators who are coming up to this, taking this platform to make it as a B2B platform. So what the concern is that the features, first of all, again, it comes to how user friendly is the application, telemedicine, and how exactly it helps to the doctor to make it life easy, right? So most of the people of doctors, they are what do you call handy giving a prescription by written, so they won't prefer for online prescriptions. That was the earlier stage, and again post COVID, most of the people, doctors are now adapting the technology and they have started writing prescription online. For an example, if you see Practo pre-COVID and after COVID, see there's a lot of 10,000 doctors are onboarded in Practo. So you see this lot of these 10,000 people writing online prescriptions. Then you can see this how this going forward, how this acceptance rate is gone high. So particular hospital, we see, because we speak on a daily basis a lot of hospitals, how they want to encounter this the new technology which is coming up. So if they are not accessing this technology, patients are moving from their hospitals. So the footfall is not happening until unless there is a serious illness. The patients comes to hospital, but apart from that, maybe the patient going to the nearest pharmacy or nearest clinics or nearest the hospital which is there for the second opinion, and indirectly and obviously he is losing his patient. So by adopting this technology, so we can do a number of follow-ups with this patient. Let's say any patient is doing in surgery or operation kind of thing. Those people cannot travel back again and again every fortnightly or something. So they can take the online consultation as a follow-up. So this is one where area most of the hospitals are looking into it for the follow-up. So the acceptance rate is also being grown. That is what I want to share with you.
So, I mean, how did your parents feel on a personal note? Just, casually, how did your parents feel?
True, great. My personal experience was it's very first time been doing it. So I've done previously because I'm techie savvy. I know pretty much. I'm working with them. I know how it exactly works. So for them, experience it a very different way. You can only experience when you see them lively. Okay. So that is one area. So they felt very good because we have consulted doctor again. The language barrier is there. So they talk to the language to Malayalam speaking doctor. So the communication between them and my parents was pretty good. So she was happy. My parents were happy that she talked to a concerned person who can express their.
So I mean, all through the discussion, we had seen you let us know about the pandemic and the sales process, individually. Now, let's combine both those things, and then if you can help us out with what were the challenges that you had faced in sales during the pandemic. How was it pre-COVID with the telemedicine that you were looking at, and how was it post-COVID, or how was it during the COVID that was going on?
Great, great. Thanks for asking this, Anirudh. So pre-COVID and post-COVID, obviously, sales is very area where pre-COVID and post-COVID. Since it's we are in this industry, healthcare industry, the acceptance again we come up the acceptance rate. Most of the people are not accepted, though there are big market players, Apollo, just like Apollo One India. I take personally when I was in different companies when one at that time the year 2015 they started. So we were saying that I personally how this gonna be accepted. Most of the people there's a very first time. Initially they also face a lot of challenges in terms of acceptance. How this gonna be work and all this. But if you see now currently after post 5-7 years, so they are the market leaders in this industry. There are big market players in industry. Okay. So you can see this the acceptance is very high. The people are accepting. And post COVID and it became a double, right? So even I started using the telemedicine consultation for my parents and all that. So for the sales, yes, there are a lot of challenges because one, the acceptance to the hospital. The second part is we started with one group sales guys, okay, pre-COVID, and there were a lot of challenges how this acceptance got about. But again, in the COVID times, you don't believe we have, we got client in every 15 to 20 days of time we have closed one deal. Okay, so then you can see, imagine that there is a lot of growth and lot of opportunity and lot of acceptance for the hospitals to adapt this technology. And from there now till date, we have not only serving for India, we also have clients from Indonesia, we got from Malaysia, we have from South Africa. So we expanded our wings. We started with the sales people, 1 or 2. Now we have team size of 8 and 9 people. So you can see the growth. Okay. Challenging, obviously, one thing is the reach, which targeted. Again, it comes under evaluation of product and services. So we have done some evaluation before going to this product into the market. So we have evaluated which all countries, which is the acceptance is high, which are those countries the use of internet is high because these platforms works on the internet. So the people they uses internet more of users of internet, then the more of chances to use the SaaS platforms. And that is where we have evaluated and where we've identified some few countries, and in particular India also where there is a lot of scope. So we have identified tier 1, tier 2 cities, and we have targeted only those. We have just focused only those tier 1, tier 2 cities, and we got results, and we are doing better now. And we have ample number of clients within hand now, and there are a lot of in pipeline also. So you can just imagine how these things are going now.
Thank you, Ajeesh. Thanks for sharing all the knowledge, to the viewers. Uh, Thank you, Sharath. If there are any questions, probably Ajeesh would be happy to answer them.
Yeah. Please.
Oh, I think there are no questions from the attendees. So before that, I just want to thank you, Mr. Ajeesh, for joining this webinar and sharing your real-time scenarios in terms of how telemedicine helped your family in the pandemic and sharing great insights about it. And thanks to all the attendees for joining and hope you gained a lot of great insights from the webinar. Thank you, guys.
Thank you,
Thanks,
Sarath.
Sharath. Thank you, Ajeesh.
Thanks,
Have a
Anirudh.
good day.
Good day too. Bye.
Thanks. Bye.